Well, continuing the conversations from Arab Health 2024, we're back at the Masimo Pavilion. Wearable technology once again in focus. Lots of AI solutions when it comes to medical care. Very kindly joined by the Chief Operating Officer, Mr. Bilal Hussain. Thank you very much once again for joining us. Now, I like the W1 watch that you've got over here. Talk to us about the reception that this watch has received and what makes it stand out.
Yeah, so I think everybody's recognized what telehealth needs to be and where healthcare is going, which is kind of breaking down the walls of hospitals. The W1 is an example of that, where we're bringing technology that is accuracy from the healthcare side that really can make an impact and a difference, and now providing that to patients at home, connecting that device back up to the cloud, and now providing not just alarms or notifications back to clinicians, but true decision support insights with our AI platform on what's going on. So the power of AI now can be enabled with wearable technologies that provide continuous data, and now we can truly have those insights for those patients back to the clinicians.
And what's going to be driving your global strategy now in terms of decision making? Because obviously with the AI solutions that you're offering to the clinicians, they must be very happy about it. And now what's the next strategy on a global perspective?
So really the next strategy is to figure out what type of patients can this apply to, right? Initially, telehealth was, focused on type of patients that didn't want in hospitals or chronic care management. That's changing today, right? Post-operatively, you don't need to keep patients in the hospitals as long. You can truly push them out and monitor them accurately. So we're changing the game on who can use telehealth in hospitals, and now move them to the home where they can be cared for by their family, where they want to be truly, yet being watched over by clinicians that can make sure they manage care properly for them.
It'll be quite interesting to see what kind of new technology can we expect, because we know that the watch can detect the heart rate. Now you've got the general sort of, let's say, when it comes to ECG as well, scanning is happening. What else can we expect from wearable tech?
Yeah, so wearable tech, especially with the PPG sensor that we have on, that's the optical sensor, you can really detect a lot. So we talked about hydration now, right? Being able to see how wet or dry or how hydrated the person is, something very important, not just for athletes, but also for the sick patients, right? If you're on certain medications, you can now tell if that patient is on medication or not based on their hydration levels. So that's very impactful. That's a new parameter that's been introduced onto the platform, and we're going to expand. We can see a lot of what's happening with the heart rate, with what's changing in the heart rate, what we call heart rate variability or pulse rate variability in this case, but even going beyond, right? So looking at the heart more accurately and continuously. So that's where we're going to be able to change the game.
Well, Mr. Bilal, thank you very much for joining us once again.
Thank you. Thank you for having me.